What differentiates enCourage Kids Foundation from other organizations in this space are our unique relationships with the child life community.
The responsivity, I think, is probably the most unique thing about enCourage Kids, is that there's just a dedication to hearing the voice of the child life staff who are embedded in the work of healing and transformation for seriously ill children.
The role of child life is really twofold. One part of it is helping children and their families understand their healthcare experience.
We're everywhere that pediatric patients are. The emergency department, the inpatient unit, the outpatient unit.
The second part of it is really normalizing the environment and allowing children to play. So you're learning how to share, how to cooperate, how to advocate for yourself.
We're going to give you the resources that are truly going to impact this child on their entire life continuum. And the organizations that get that and understand that know what we need to be able to do that.
And we're able to provide resources and funding for programs and elements that are often not covered in a hospital's regular budget, but that elevate the level of care that the hospitals are able to provide to patients.
So I can tell you for sure, we would not have a licensed creative arts therapist in art therapy without the support of enCourage Kids Foundation.
The first time we had a real music therapist was really when enCourage Kids gave us that funding.
We were able to approach enCourage Kids about Kids Zone TV, and I think enCourage Kids was excited to be involved in it from the ground up, and to this day it is the most powerful modality.
Through our very close relationships with our hospital partners, we learned that mental health is in a state of crisis.
Post-pandemic, there's so many children who are really struggling in terms of their mental health, but they're admitted to the pediatric unit for an ear infection or appendectomy or a broken leg.
They're not just being treated for their physical ailments, they're being treated for what's happening with them mentally as well. As a result, we developed these wonderful, safe kits for children who are suffering mental health crises.
The biggest thing about enCourage Kids is that because of the understanding how we attend to the emotional safety of children, that it isn't limited to just one area space.
The Send a Smile, Send a Bear program started locally and has become a signature program for enCourage Kids.
We have used enCourage Kids Bears for as long as they've been around.
The enCourage Kids Bears are great for medical play. You know, it's one of the things that we as child life specialists advocate for is therapeutic positioning when a child has to have a procedure done.
And it helps the kids be less scared when they have the actual procedure. The Bear program has really enabled us to expand nationally. And we now partner with more than 300 facilities in all 50 states.
And now the entire hospital support program is available to hospitals nationally.
So many times there are organizations that stay local and stay true to their, roots and foundations. And the supportive organizations like enCourage Kids are saying, okay, we get it, and we're gonna make you a priority, and we're gonna help you succeed. And to show children and families that they matter, regardless of where they are, where they're from.
And I think it creates an integral conversation within the world of enCourage Kids having to do with how can we do better? How can we improve that experience for all children across the country?